Today, we're digging into some really fascinating developments in digital health, things that are moving fast.
That's all right.
We're using a weekly digital health report as our guide, and, well, it's packed with some pretty cool stuff.
Yeah, it really is. Our job today basically is to pull out the key insights for you.
Right.
We want to show how technology isn't just, tweaking things anymore.
Yeah,
It's
we got it.
genuinely transforming how healthcare works, how it's delivered, how you access it, and how efficient it can be. We're looking for those connections.
Okay, let's dive straight in then. First up, something with huge potential. XR extended reality for mental health, specifically in the military. We're looking at a company called Healium. They're a medical XR company, and they just landed this significant sole source contract with the U.S. military.
Right.
And that term sole source, it kind of makes you pause, right? What does that really mean here? Why just helium?
Yeah, that's a good question, and it's important. So Helium's technology, their VR and AR apps, they're interesting because they actually connect with external wearables.
Wearables, like for neurofeedback or biofeedback?
Exactly. Neurofeedback, biofeedback devices.
Mm.
And the whole point is to train and reward someone's ability to consciously calm themselves down or focus.
Okay.
So the user, the soldier in this case, can actually see their own biometric data in real time. Things like EEG brain patterns.
Wow, brain activity.
Yeah, brain activity, heart rate, even skin conductance, blood pressure. It gives them that immediate feedback.
I see.
Now, about sole source, the Small Business Administration's definition is, essentially, that it's a contract that doesn't need competitive bidding. Usually because the government agency decides only one company, truly fits the specific needs.
Okay, so Helium was uniquely positioned.
Apparently so. And this specific contract, it expands their tools for things like PTSD, anxiety, sleep issues,
Yeah.
directly to military personnel.
Mhm.
It actually builds on work they'd already done with AFWorks. Yeah, that's the innovation arm of the Air Force.
Yeah.
So they had a track record.
So if this tech is literally training self-calming, is this moving beyond just treating issues after they happen? Is it more like proactive digital resilience building, giving soldiers a new kind of mental toolkit?
That's a great way to put it. I mean, it definitely points towards equipping individuals with self-management tools.
Right.
It could potentially reduce the need for some traditional interventions later on.
Right.
And it's scalable, which is huge.
Absolutely. That idea of empowering individuals is powerful.
Yeah.
Okay. Speaking of access, let's shift gears a bit. A different but equally vital area, making obesity medications more accessible.
Yeah, a big one.
We've got a collaboration here between 9M Health and the Mark Cuban Cost Plus Drug Company.
Yes, this is a really interesting partnership tackling cost and access. So 9M Health, they're a virtual cardiometabolic care company.
Correct.
They're now going to use lower cost oral medications from Cost Plus Drugs as an alternative treatment for obesity.
Oral meds. Okay. Not just the injectables we hear so much about.
Exactly. And it's worth noting, 9M Health already works with self-insured employers, providing branded GLP-1s through, direct deals with manufacturers.
Right.
But this Cost Plus Drugs piece adds another layer. Their shared goal seems to be helping employers who want to cover weight management and related conditions, things like diabetes, high cholesterol, hypertension.
So expanding the options.
Right. And the key is employees get these meds along with 9M Health's care team, obesity specialists, endocrinologists, the whole package.
Integrated care.
Yeah. The COO of 9M Health, Paul G. Varghese, basically said they're offering medical management of obesity without a large price tag. That's the goal.
So by mixing these lower-cost oral meds with that comprehensive virtual support, are they kind of creating a new model, a different way for employers to handle these chronic conditions, maybe more sustainably than just relying on expensive branded drugs?
I think that's exactly what they're aiming for. It definitely broadens the toolkit, makes it potentially more economically viable long-term for these employers, and that's a huge issue right now.
Yeah, no kidding. Okay, so from those broad employer solutions, let's zoom in. Let's talk about diabetes and insulin management, specifically with AI.
Okay.
Glytech, a software company in the space, just got a pretty big $36 million growth investment.
Yeah, that's significant funding. Glytech's system, it's called Glucommander.
Glucommander, right.
What it does is analyze patient data in real time to give recommendations for insulin dosing.
Ah.
And it's pretty smart. It pulls in historical data, looks ahead, factors in patient-specific stuff, and it integrates with the hospital's electronic medical records, the EMR.
That integration is crucial, I bet.
Absolutely crucial. So this new funding, they're saying it's for R&D, growing their team, but also It helps them align with new CMS quality measures.
CMS, Medicare, and Medicaid.
Yep. Those measures are starting to hold hospitals accountable for how well they manage blood sugar levels for inpatients. So Glytex Tech fits right into that.
Makes sense.
And they've got partnerships already, like with MUSC Health in South Carolina, integrating into their Epic EMR system. And just this year, they partnered with Roche.
Roche, the pharma giant.
That's the one. To get their software working with Roche's Cobas Pulse, that's like a smart blood glucose meter used right at the point of care in hospitals.
Okay.
It's used globally, even for tiny, Hinge Health. They're mostly known for their virtual physical therapy, their app-based programs.
Yeah.
But now they've launched something called Hinge Select. And this is basically a hand-picked network of in-person providers.
Oh, interesting. So mixing virtual and real world.
Exactly. Think imaging centers, traditional physical therapy clinics. The whole idea is to bridge that gap, between digital care and when you actually need to see someone face-to-face.
An end-to-end model.
That's what they're calling it.
Huh.
A comprehensive end-to-end MSK care model. The benefits they're touting are, well, their tech and their own doctors can triage you first. Then, if you need in-person care, like an MRI or maybe an injection, they connect you to these pre-vetted providers. And they claim it can be at rates up to 50% cheaper than typical PPO rates.
Wow, 50%.
Yeah, pretty significant savings potential.
And it's meant to be seamless. They have their own orthopedic specialists you can see virtually, often within like 48 hours, for diagnosis and planning.
That's fast. Right. And you can book those in-person appointments directly in the Hinge app. And the records from that visit get shared back with the whole Hinge Care team. So everyone's in the loop.
So for you, the patient, this integrated approach, it's not just about saving money or convenience, is it? It sounds like it breaks down those annoying silos we always hit in healthcare. Like your virtual PT knows what the imaging center saw and what the specialist recommended. A truly connected journey.
Exactly. It's about reducing that friction, making sure the left hand knows what the right hand is doing, which often doesn't happen in MSK care today.
Yeah, tell me about it. Okay, last segment, but it's a big one. The money question around AI in healthcare.
Right.
We hear a lot about reducing burnout, which is great, but what about the actual financial return?
The ROI.
Exactly. We've got some new data here from Ambience. What are they telling us?
Well, Ambience, they provide that ambient AI documentation, the AI Scribe tech.
Right, listens in the background.
Yeah. They put out some really compelling numbers. They're saying their tech can help health systems bring in an additional $13,049 per clinician per year.
Whoa, okay, $13,000. That's not insignificant. Where's that number coming from?
So it's based on Q1 2025 financial data. They piloted and rolled this out across like 41 different specialties at St. Luke's Health System out in Boise, Idaho.
Okay.
And this data is timely because, frankly, these AI scribe companies have been under pressure to show the money. Burnout reduction is one thing, everyone agrees on that, but demonstrating hard financial wins has been a bit trickier sometimes.
So how did they get to that $13K figure? Where did the extra revenue actually come from?
Okay, so the breakdown is interesting. The biggest chunk, about 3/4 of it, actually $9,685 per user per year, came from better HCC capture.
HCC, hierarchical condition category.
Exactly. Think of it as accurately documenting all of a patient's health problems, especially the complex ones. Better documentation means more accurate reimbursement from payers.
Got it. Capturing the complexity.
Right. Then another 1,907 zevels per clinician per year came from increased EM coding complexity.
Evaluation and management codes.
Yep. Basically making sure the billing reflects the actual level of work and decision-making that went into the patient visit. Again, better documentation leads to more appropriate coding.
Okay, so better coding, better HCC capture. What else?
And the last piece, about $1,456 per clinician annually, was because the AI just made things more efficient. Clinicians were able to see slightly more patients per day.
Right, the efficiency game. So the implications here seem pretty clear. If AI can provably boost the bottom line like this, how might this specific data from Ambience change things? Could it really push wider AI adoption in hospitals, ultimately making things more efficient, maybe even impacting the cost of your care down the line?
Well, this is exactly the kind of concrete financial data the industry has been looking for. It helps frame AI not just as a nice-to-have for doctors, but as a potential financial engine for the health system. It definitely sets a new kind of benchmark for ROI in this space.
Wow. Okay, we have covered a lot today. I mean, from VR for military mental wellness to making obesity drugs more affordable, AI fine-tuning insulin, integrated MSK care, and now hard numbers on AI's financial impact. It's quite a range.
It really is, and it raises an important question, doesn't it? What's the bigger picture connecting all these different innovations?
Yeah, what's the thread?
I think the thread is this accelerating integration of sophisticated technology into pretty much every part of healthcare.
Right.
Prevention, diagnosis, treatment, even the back office operations. It's not on the fringes anymore. It's becoming really foundational.
So thinking about all these things adding up, this data-driven, tech-infused approach, how might it fundamentally reshape your future experience? Your experience with health, with wellness, with medicine. Could it even change what it means to be a patient, or maybe how you just stay healthy in the first place? It's definitely something to think about, a profound shift potentially underway.